this video, I thought it would just be kind of cool to talk about, let's say, the process and like how people meet for the first time and everything. Mm-hmm. So I did meet on the virtual consultation. So we did that whole passing of photographs and all that stuff, and you told me a little bit about what you're looking for and all that kind of stuff. And in your case, we also talked about doing a video.
Yeah.
Okay. So the fun part is, so now she's here. So you make an appointment and then people come in. I have a lot of out-of-town patients, which kind of makes it a little bit more interesting because it's like, how do you examine a patient that's far away? Mm-hmm. But what we do is we'll do a FaceTime and stuff like that. But she's in person because she's probably from around here, so it kind of works out really nice because you get to meet her. Now, and I got to make fun of her a little bit because I can do that because that's where I am. So she's got her phone handy because we all love our phones and we got to have that security thing. And then we got these questions. Now I love it. And she says questions and ETC, which is really kind of cool. And so we'll put these to the side for a second here because what we sure. kind of will do is that she's nervous, right? You're a little nervous? Or what are you nervous? You worried more about the camera? You worried about me or the whole thing? You never did this before, right?
I've never, no.
Yeah, so she hasn't done a lot of things. So why don't you take this this mask because we get to see your nose. And Eric, I'm going to ask you to hand me my lighted thing. Can you move away from there? Yeah, that our little headlight stuff. So all us nose job guys, we tend to run around with something similar to this, and it's just a device that we use to provide some light and some magnification so that we can see the nose in some detail. But we're probably going to start off really first by just discussing like her nose. Okay? So what is it about your nose that you don't like? Or what do you want to change about it?
So I broke it like 6 years ago, and ever since then I've always like noticed kind of like a bump that makes it feel kind of crooked to me. It doesn't feel like straight. And I've never liked my profile view. I have my dad's nose, so it doesn't feel very feminine to me personally.
Whoa! Careful, Dad. It's funny now that you bring something up that I'm interested in. So, what's a feminine nose and what's not feminine about your nose?
Well, it depends because I have there are women that I think are pretty and have feminine facial features, and I feel like the tip of my nose is kind of circular or it's kind of big, and the ones that feel feminine are more petite, refined, they have gentler features in general, but their nose is more it's a little more petite. I like mine feels kind of straight down the front, and I like the ones that look really petite, feminine to me, have a gentle slope kind of.
Gentle slope. So gentle slope going into a more refined tip and an overall smaller nose.
Yeah.
Agree with that totally. I mean, that's a great assessment. It's I was going to write a blog about, what makes a feminine nose, but now I don't have to blog. If you want to know what it is, you just watch this video here. So if you look at her, her nose is deviated a little bit, and she probably has a broken bone because I could feel there's a little step off in this area here. Her bones are pretty high in this bridge area here. Her nose is a little bit long because it's just a bigger nose than it needs to be. And she's got some really big cartilage relative to everybody else in the tip area here. What's really nice is she's got some nice thin skin here. And if I push on her nose, I can actually kind of get an appreciation for the cartilages that I show you all the time in my video. Left and right, and there they are right there. So, and she's a little wide here, or she flares a little bit in the infratip area here. Her angle at the side of her nose is almost 90 degrees. I try not to get crazed out about the whole thing, but when we shorten her nose, we're going to just slightly rotate the tip ever so slightly, and that's going to give her a more favorable angle at the bottom of her nose. So you can imagine, smaller nose, just as she said, a little bit more of a slope, less mass in this region over here, less mass and a better shape in the tip area, slight rotation of the tip complex. Home run city.
What do you call the line that's this dip? Right?
Yeah, those. So she has. We call it. We call it a lot of things. But she said a bifurcation of the columella, which basically means that the two cartilages that make up the columella, this part over here, they're kind of separated and they kind of flare out a little bit. So we're going to probably make that more uniform. You can see that right here. We call that a bifid tip. And so she just has 2 cartilages. So again, that's actually another important feature of a feminine nose. You know, some guys can have like, you know, some brusque features and some sharp features. It seems to go with guys in general. But with women, we want more of a smooth contour. We don't really want these, you know, angles and sort of step-offs and things like that. A smooth, gentle dorsum that leads into a beautiful tip and a relatively small nose relative to her face, by the way, and that's a total home run. Now, one of the things that I got excited about her was, well, she's naturally very beautiful, which is a big deal. So what I like to experience with noses like hers is that whole, oh my God, when you walk into the room or when I see her back for the first time, and I'm not even looking at her nose. I'm looking at her entire face, because what happens in essence is that it's like you have this thing that sits in the middle of your face that is a little bit overpowering. It's not as feminine as you want. It's bigger than you want. And then when you make natural changes in that and you sort of obtain this feminine, smaller nose with all these features that we described, it's a game changer. Because then all of a sudden you're going to see her natural beauty. I mean, everything, her hair, her beautiful forehead, these amazing eyebrows. You know, sometimes I sound like, geez, Bob, take it easy. But remember, I'm a plastic surgeon, and I'm asked to deal with people in my life to give them features that she already has, right? So therefore, it's easy for me to just sit there and admire these features, because these are the natural features, you know, higher beings sort of, Mother Nature took care of this, and, you know, it's just a beautiful thing. And so my job is really to work with that and enhance it and make sure we do it in a really cool manner so that it's all kind of done well. How's your breathing?
It's bad because of allergies, but otherwise.
So when there's not a lot of allergies, it's not so bad.
Like right now, it's
well,
fine.
Welcome to my world. So we're in allergy central here in this part of the country, and so the implication of breathing is a big deal to me, as we've discussed in a lot of these videos. Because if you have trouble breathing, and I make your nose smaller, then it's highly likely that you're going to have more trouble breathing, and that's not what I want. So under those circumstances, I have to do internal work on the inside of the nose to kind of clear things up, so that when the pipe is smaller, I can still get the good airflow that I need. And thankfully, I never promise anything. I never tell people that I can guarantee you're going to get everything and your breathing's even going to be better. It could be worse, actually. However, thank goodness, it's very unusual. In fact, patients I've seen back for the past few weeks have all told me, oh, incidentally, my breathing's a lot better than it wasn't before, and you made my nose smaller. And so I call that a home run. And I forgive me for promising nothing but delivering more if it's the worst thing about me. I think life is pretty good. Has anyone examined the inside of your nose?
Only once. I almost got surgery shortly after I fell and broke it. Mm-hmm. One of the things that I don't know why this was important, but they noticed that one side collapses when I breathe in. Yeah, well, that's a good. I mean, what happens is the bones shift over, and then the cartilage comes with it. So the passageway is narrower. So when you're breathing, the air travels on that narrow side faster, which creates this negative pressure and blah blah blah. Whatever. It's like the laws of dynamics or physical laws and all that kind of stuff. Which reminds me, one thing I tell all patients who don't have a perfectly straight nose is, if you expect a perfectly straight nose when you don't have a perfectly straight nose, I can't help you. And that's my cop-out as well, because although we can probably make it straighter in most circumstances, if your expectation is a perfectly straight nose, I always encourage my patients to go seek services someplace else. And that's my sarcasm way of saying it's very difficult to make a perfectly straight nose. And if that's your promise and that's what got you to the particular physician, better them than me, because it's pretty tough. Having said that, we make it as perfectly straight as possible, and all the other changes together make for a perfectly cool nose, which then goes into the whole thing about expectations. You know, the greatest thing about noses is if your expectations are even remotely realistic, this is a game changer. You're gonna love this. If you're persnickety, if you're fastidious, what's the word that other people use? If you're like, what's the word, Eric? When people are, what's the word? Perfectionist. If you're a perfectionist, then you got to worry about stuff, because sometimes people pick themselves apart. You know, it's like,
during the healing phase. Oh, one side's bigger than the other, or you got whatever. You got to let it heal, and everything's going to be pretty darn good over time. Eric, can you grab me that little speculum there? So while my nurses are running off doing all sorts of stuff, my videographer not only has to be the videographer, put your head back, but he also has to be my assistant, which is kind of cool. I mean, you know, we don't stand on, we don't stand on ceremony. We got to take care of business. And then certainly you can see the bifid nature of the columella. So basically you can see this little shadow in the middle, one cartilage here, and it sort of looks like the way it looks because they're slightly separated. So one of the things I'm going to do during the procedure is just kind of bring those cartilages in together so it makes a unified infratip area here, and the columella is just looks like one. This speculum here is a device that just allows me to kind of peek in to see what's going on. And when I look in here, I'm looking at a turbinate on the right side here that's moderate in size, but not terrible. She's got very significant deviation of her septum to that side. So what I'm thinking is she probably took a blow to this side, and that blow buckled her septum a little bit, like a big old door in the middle, and it buckled to the left side, okay? So she does have curvatures of the septum a little bit. And sure enough, if I look in here, she's got very significant curvature, and it goes way back there. She's got like an S-curve in here. The turbinate's pretty reasonable on this side, but right now I'm thinking to make her nose a little bit more interesting, I'm going to have to do a fair amount of work on the inside just to kind of adjust the plumbing, if you will, because if she's having some problems breathing now, or if it's just allergies, there's the potential that if I go in there and straighten out her septum and just kind of clear up her turbinates a little bit, that she'll actually breathe better, okay? Again, particularly because I'm making the nose smaller. So this is a bunch of work I'm going to do on the inside before I even get to the outside. So that's the non-fun part. We don't really film that much because you really can't see much. And I don't really get much credit for other than, oh, I can breathe fine, which is like, oh, great. I mean, that's what a nose is for breathing. And I'm going to shorten up the septum as it is down here just a wee bit. And again, I think I was talking about her skin a little bit. She's got perfect thickness of the skin. So what's cool about that is some of the changes that I'm going to make on the outside of her nose are going to be clearly visible. One of the limiting reagents to any nose job, almost the primary limiting reagent, is the thickness of your skin. If you got really thick skin, you got to deal with it. And I have patients that have thick skin, and I tell them, you have thick skin, it's going to limit, and they still kind of wish. But at some juncture, you just have to deal with it. There's no, I'm not going to cut the skin out on the nose, and it's been described where you actually make incisions to remove the skin. But, I think that'd be something that would be horrible scars, and you definitely want to go down that way. You just have to accept reality to some degree. Anyway, so what say you?
That's exciting.
That's it? I do all the song and dance for you, and then she says that's exciting. Okay, so let me just ask some questions out of the blue that maybe, people have questions. All right, so what are you most concerned about?
I feel like, I don't know, I feel like I'm concerned about, if anything, like, I was concerned about us having a different vision, but I'm not concerned about that anymore, I don't think.
You mean different vision in terms of your goals and stuff?
Yeah, what's possible.
Yeah. Why has that changed?
Because I felt like when you were talking about it, even without even getting that much input from me, it was basically what I was envisioning. Yeah.
That's a good thing. And I think what you're basically saying is we have to be on the same page. Because if we're not on the same page, it isn't good. Trust me. And I've been doing this for 30 years. I could tell you I've seen a lot of stuff, but I can make a perfectly amazing nose, and people are really not that happy. And that's a bummer. So, and what I try to kind of convince people of is that as much as you need to kind of interview me, I'm interviewing you. And so what that means is that it's like, well, doc, I want to make sure. Well, I want to make sure too, So that's why this process is sort of the give and take. And if I hear things, and I'm sure you do too, if you hear things that don't make any sense, you're like, oh, well, whatever. if I hear things that are sort of a red flag, then that sort of brings me out of the equation. I get less enthusiastic about fixing your nose. And when I look at noses, I just really look at what's possible. You know, we can go crazy in some degree, but that's not me. I'm sort of a natural kind of what I can do by keeping it real. If you swing for the fences, you can strike out. And so nobody wants to have a nose that someone struck out. You know, you want to have a nose that kind of fits all the bills. In my earlier career, I probably didn't make changes in noses as much as I thought I could. That's why it really takes a long time to get that experience and confidence by seeing people over a period of time, so that you can build a nose that's really a consistent and fairly reliable result to make you happy. All the things that we talked about is all that we can do for your nose. You know, make it smaller, refine the tip, slight rotation, and improve the breathing. If we did all those things, that's a total home run. If the worst thing is you come back and you say, well, it's still not perfectly straight, I'd say, well, let's go back to the video. And I told you it wouldn't be. But it's not something you should dwell on at all. And sometimes you got to kind of take your result and own it. You know what I mean? You got to own it. And thankfully, for the overwhelming majority of my patients, it's a game changer. I mean, so the things that I put in your way of like, you know, well, I don't know. Well, I actually know more than I give away. And so what's fun is that when the day we take this down and we look at our nose and your reaction for the first time. Who knows you're doing this?
My parents.
Are they supportive?
As much as they can be.
As much as they could be.
My of course, I have a family nose, but it's my dad's on my mom's side, and she's just like, "What? You look fine. You look fine."
Yeah, and you do, by the way. We know that. And you don't want to disparage the family nose, although there are probably 4 or 5 emails every day that I answer online that are, you know, your nose is actually pretty good. You know, people have slight little humps, but it almost works with their character or maybe where in the world they're from. It's a lot of factors you have to take into consideration. And your nose is fine, right? It works, and it's not terrible. But I would tell you that what we'll do, hopefully, is create this nose that even your parents will be like, wow, that's pretty cool. And I dare say you won't remember, and your parents won't even remember what your nose used to look like, which is the cool part, because what happens is you incorporate this new nose that you have. That's why we go from you seeing it for the first time, and then you've seen my other videos, and these people are like, oh, you know. But over a period of time, you have to incorporate that new concept of you. Mm-hmm. And then what's really interesting is you can't even remember what the heck you used to have. And so therefore, it doesn't help me any good when you walk in the room and you're like, oh, it's okay. And I'm like, oh, it's okay, right? And then we pull out the before and after. So it's like, oh my God, it's amazing. But that's human nature. That's really the cool aspect of sort of how people adjust to whatever. Give and take. People who have bad things happen to them, not necessarily plastic surgery, but they adjust to their situation and they accommodate to it and all that other kind of thing. What else? What are your other concerns? I mean, you had your list.
I don't know. Your nurse was very informative.
They know a little bit.
Really.
Yeah, we know a little bit.
She
you know.
put me at ease for sure. Because one of my biggest concerns is, like you say, like that no one was like necessarily supportive of me having surgery. I think like my mom were on the side of, well, you broke your nose, so like fine. You know, like I get it. You can see things other people don't see, and I'm like, yeah, it's my face that I see in the mirror. So I see it like hundreds more times than anyone else. So you see me and you're like, well, you look fine to me, but I have to like see myself every day when I look at whatever bothers me. And I'm like, I have the means to fix it. So I don't know what I would like. I have the rest of my life ahead of me. Like if I could change it and feel like more confident, then.
I mean, she's spoken like a trooper, man.
Yeah.
And you're absolutely right about that. And so having said all that stuff, I could tell you this, folks. The responsibility that I have is to make that come true in a safe, reliable, and consistent manner. So that's why I sometimes think people are like, why do they hesitate to do stuff? It's because things can happen. And, this is where I try to say, I'm not perfect and I'm not, the almighty, but I can tell you that in good hands, things like this should be pretty reliable and consistent. And if it weren't, I probably wouldn't even offer this to you. You know, I got to tell you, I have my own kids, and so I definitely understand the responsibility, and like, you know, I have to make sure you're happy, and I want to make sure your parents are happy, and I have to make sure that the reputation of all plastic surgeons is sort of enhanced in the sense that, you know, go to good docs and kind of good things happen, and we should never like. The thing about noses is that everybody knows a nose is a special area. You don't just go to anybody for your nose. That's just, I think we already got that down. But if you go to good people and make sure you vest them and know that they're on par with your expectations, this is the funnest thing in the world. Actually, I don't get nervous at all. I told you I'm excited to do her nose because it's because I've been there a million times in a lot of ways, and so I just can picture you when we're done. And sort of that whole thing, and it's just going to be a cool pickup. And I think Eric's going to do a nice job of sort of capturing some of these changes. And thanks for your consideration and all that kind of stuff. So anyway, this is the process. This is how you meet people. This is the discussions that we have here. And what's going to happen now is you can talk to the nurses and stuff. We're going to probably, I don't know where we are in the whole scheme, find a date. Are you scheduled already? Mm-hmm. So she's already scheduled, and I write down on my little cheat sheet on things I'm going to do to your nose, and we're going to talk about some of the internal stuff, and then I talk to myself, and I do the surgery, which is funny. It's like, actually I already did her surgery. And so you could see the only area that I was slowing up is like, I got to get through the internal nose, Because when I get on the outside, even though that's the meat and potatoes, it's the inside that has a lot of, I'm in a small little space doing a bunch of stuff. So that's some of the work I have to get to before I get to the fun part, that kind of stuff. But it's important because you can't breathe. It's just like a bummer. And so having said all that stuff, we're going to wrap it up for now. And we're going to pick this up, I guess, on the day of her procedure. All right, so as I look at her nose again, I see a relatively long nose. She has a small hump, not a huge hump, but a small hump. But it's real. She's a little bit wide in this region here. She's a little bit wide in the nasal bones. Her tip is really not as refined as it could be. She has a bifid tip, which means it's just kind of divided over here. So we're going to try to smooth the tip up a little bit so that it just comes to a nice overall natural shape without some of the sharper angles. We're going to shorten the nose a little bit, just rotate it ever so slightly. Just really take away some of the exaggerated features of her nose. And what we talked about is that I think that that's going to be the easy part in her case because she has some significant internal derangements. In other words, her septum in the midline and the turbinates are a little bit out of sorts. Do you have breathing problems or no?
Not too bad, but terrible allergies.
Yeah, well, welcome to Texas. This is allergy capital of the world. Not nice. But what happens with allergies, it causes pretty significant swelling of the tissues, and then it blocks things up. So because every nose job or most nose jobs that I will do are to make the nose kind of smaller, if you make the airway passageway smaller, then that's going to block your breathing. So there's some maneuvers that I have to do ahead of time to make sure that she can breathe afterwards. So a lot of the work that you probably won't see me do today is the stuff on the inside because you really can't see. So I'll do a lot of that work, and then we're going to pick it up probably when we start the outside, and we can show you the fun stuff and all the changes that go on. Other than that, I think we're ready to rock. You're ready to rock, it sounds like. And it's just actually pretty cool. I'm going to take her pictures, and then we're going to get back, and we're going to show you how we do it.
I'm going to show you with what it looks like, okay?
Okay.
Remember what you had, okay? So you look
I'm
at
still
this.
expecting a lot of swollenness, right?
Yes,
Okay.
yeah, because you are only 10 days out.
Okay.
So you see here, I mean, you can see here on this camera that you see that you're crooked,
Yeah.
right? And like
Yeah.
you were showing the photos, that you see the difference
Yeah.
in what you had before your
Yeah.
trauma. This is post-trauma.
Mhm.
This is post-nose. And you're still really early.
Yeah.
You're really
Yeah.
early on. You're only 10 days out.
Mhm.
So now I'm going to do the big reveal.
Oh, God.
So now you get to,
I'm so
mind you, it
nervous.
is still swollen. So.
Yeah. Oh, weird. Oh, my gosh. Wow.
So you
It's so
see how
straight.
it's already, yes, I was like,
straight.
and you are swollen, like your
Mhm.
tip is quite swollen, like right here, it's quite
Mhm.
swollen, but you see how it's more round. You
Mhm.
had almost a very prominent
Yeah.
tip.
Yeah,
So
the
it's more-
like weird ass shape.
Yeah.
It was such a weird shape.
So it's more of tip, it was more tip refinement,
Mhm.
so that you can definitely see that now
Yeah.
compared to
Yeah.
this, right?
For sure.